Well, and now for his take, we're joined by Dr. Jeremy Faust, an emergency medicine physician at Brigham and Young Women's Hospital and writer of Insider Medicine on Bulletin.com. Thanks so much for being with us, Dr. Faust. I want to start on that question of how concerned vaccinated people should be about the risk of reinfection.
Thank you for having me. I think that the next 7 to 10 days are going to help us answer that question. We really want to ask very carefully what we are after in terms of measurement, because there is a difference between how the vaccines perform in terms of preventing an infection and preventing a bad outcome from that infection. You can imagine a virus, some other virus that infects everybody but causes no symptoms at all, short-term or long-term. Nobody would care about stopping that infection, but we would care if there was suffering and morbidity and mortality and death. And so we want to see how this is playing out. I think that many of us are starting to suspect that our vaccines will not prevent as many infections for this variant as we saw with Delta, but we're still hopeful that the longer-term effects of the immune response that we make does protect us. That's how these vaccines were designed. The fact that they stopped infections up front was kind of a gift, and I think that that gift is sort of fading.
So do you recommend that people do get booster shots, or do you think they're safe enough being fully vaccinated?
Well, my look at boosters is a little unusual, maybe from my colleagues. I think that boosters are absolutely shown to be effective and necessary for older populations and very high risk individuals with advanced cancer or immune compromise. I think that we saw from Israel and other places that for younger, healthy people, that the booster has not yet been shown to stop severe outcomes. In other words, the 2-dose series is enough. The 3rd dose doesn't help in terms of keeping someone who's in their 20s and 30s out of the hospital because the first 2 doses are just so good. Now, with Omicron, we don't yet know that. And so I think that it's going to be interesting to see. We may end up needing a variant-specific booster, and that would be a very different scenario. So I think that right now it's too soon to know whether boosters are really going to change the character of this outbreak. But anytime I see any outbreak of this virus, whether it's the original strain or any Greek letter that we've encountered, I have the same reaction. All outbreaks are bad, and vaccinating as many people up front is the best way to decrease the long-term, and even in the short term, of course, suffering, morbidity, and mortality.
Yeah, as you say, there are a lot of manufacturers looking on whether there should be an Omicron-specific variant. Thank you very much, Dr. Faust, for your time.
Thank you.